The diabetes medication Ozempic is being called a weight loss wonder drug on social media.
Celebrities and influencers are endorsing it as a fat melting miracle. Comedian Chelsea Handler, in fact, even joked about it at Sunday's Critics' Choice Awards.
So gaslighting is when someone tries to convince you that your own perceptions of reality are wrong. Like when celebrities say they lost weight by drinking water, but really it's because everyone's on Ozempic.
Ozempic is prescribed by doctors to manage blood sugar levels in patients with type 2 diabetes. So how did we get here?
Joining us now to talk about this issue is Dr. Diana Lev from Dignity Health Northridge. Thanks so much for being with us. We appreciate it. So first up, let's start with this. Would you prescribe this to your patients that want to lose weight?
I definitely would, but not to patients who want to lose weight. Patients who are morbidly obese, patients who have already tried the things that are healthier. This is not just a drug to take for weight loss. This has side effects.
And there's all this outrage when people are saying, no, I'm denying it. Where does that outrage come from? Because this is simply a diabetes drug and it's being used for other things?
First of all, it's not FDA approved for weight loss, but it is being used because we know that it's relatively safe. And one person uses it, another person uses it, and word of mouth spreads. So a lot of people decided that it's their antidote for weight loss, but it's not. Like every other drug for weight loss, it's only good for as long as you take it. It's not going to cure any kind of weight issue. You have to eat healthy and exercise. People have to change how they live, but nobody wants to change, so they want a drug.
What are the side effects?
The more common things are nausea, vomiting, abdominal pain. The issue becomes that it can also cause thyroid tumors, thyroid cancer. It's contraindicated and can cause pancreatitis. So technically, it can cause demise. It can kill people.
We're hearing about the shortage. So if I'm a type 2 diabetes patient and I rely on this, is the shortage, how real is that shortage?
The shortage is real. It's very hard to find. In the beginning, I could call other pharmacies and patients could call other pharmacies and they could find them because people still get them. I mean, it's not completely out of stock. It's just that there's not enough. But the issue now is that people really want Ozempic specifically. There's other medication out there that works the same way. So the shortage is very real. My diabetic patients, I switch them to other medications.
Like what?
There's Victoza, Mounjaro, there's Tanzium, there's Trulicity. There's other medications that actually work as well. But this is popular. It's become word of mouth popular.
Do we expect it to become FDA approved for this reason, for weight loss?
We all expect it to be at some point FDA approved because it does work for weight loss. But again, it works for significant weight loss. If you need 5 or 10 pounds, please, one, don't take something that could cause infection, okay? Don't start shooting yourself up with things. These aren't pills. This is injectable. You have to know how to inject yourself, first of all. Second of all, don't do things that can cause you harm. But it should be FDA approved. And it would be much better if people could learn to live better. Go to a nutritionist. Go through all the processes. This is meant for people who have really tried to lose weight and cannot, even though they're doing the exercise, they're basically dieting correctly, and not as a diet, but they've changed their life and are eating healthy.
Sure. All right. Learned a lot. Dr. Diana Lev, thanks so much for your perspective.
Thank you.
Thank you.